extreme cold conditions. Hospitals and emergency rooms know that they're going to see an increase in cases of cold exposure, frostbite, and frost nip.
Now, Marissa Thomas joins us live outside our studio. Marissa, you talked to a UPMC Hammett emergency room doctor today about how to stay safe and healthy in these frigid temperatures. So what did you find out today?
Good evening, Lisa and Caleb. Dr. Erin Reese was able to tell me when you're outside in these conditions, the things you want to be cautious of is making sure that you are bundled, wearing many layers, and also pay attention to those around you who might be experiencing hypothermia. With cold temperatures and strong winds, emergency rooms see people coming in from cold exposure, especially the homeless. Dr. Erin Reese says for the emergency department, the cold brings a lot of concerns.
We do see a lot of people coming in just to get out of the cold. We worry about frostbite. We worry especially about their hands and feet. Sometimes people's shoes are damp or wet, and that can really escalate the amount of time that they have before frostbite sets in. We worry about people sleeping outside. We worry also just about people going out and shoveling with, maybe some history of heart disease and those kinds of things.
Dr. Reese says for anyone going to shovel or overall going outside, you want to bundle up and cover all of your extremities.
People should definitely keep warm, keep dry especially. So definitely gloves and hats, scarves, keeping as much of your face covered as you possibly can, making sure that you're dressing in layers so you're not getting sweaty and kind of damp under your clothing, because that will make you get cold faster.
Also, Dr. Reese says watching out for warning signs of hypothermia and checking in on older family members is a good idea.
Watching out just for any signs of anyone around you becoming hypothermic. So looking to see, are their extremities becoming pale? Are their faces getting red? Those types of early signs. You also want to think about, even being in an indoor environment with the power outages that we've had. You want to think about maybe even your elderly family members or neighbors, making sure that they're not keeping their heat too low, or that they do have heat, as far as just making sure that they're not becoming hypothermic in their own homes.
Dr. Reese also said that if you are feeling unwell because it's flu and cold season, that you might want to stay inside because the cold temperatures can impact your breathing. Live from the weather deck, Marissa Thomas, Erie News Now.